Doctor's office can be scary, especially if they're working on your heart. But there's an app developed by an Austin doctor that can ease some of your worries.
I'm going to be 81 October 1st.
Donald Schleiser feels great and is grateful for every day.
When he told me that I had a 98% blockage, it scared the hell out of me. For the grace of God, go I into a stroke.
But that fear didn't last long.
Presenting CardioVisual.
Schleiser learned exactly what would happen during the angiogram that he needed thanks to CardioVisual.
When he showed me the app and told me everything, how it worked, it really relieved a lot of anxiety.
The hope for the app, for CardioVisual, is to allow patients and their families to decrease the anxiety associated with medical illnesses and the treatments for those medical illnesses. So I can draw on the app.
Dr. Michael Grad is a cardiologist with Cardiovascular Specialists of Texas. His colleague within the practice, Dr. Manish Chauhan, developed the app.
For years we had paperwork that would give patients and we'd say, go home and take a look at carotid artery disease or blockages in the neck arteries or blockages in the heart arteries. And you'd see this face, this, I don't know where to go, I don't know where to look.
Well, he showed me every step of the way, and you know, they put the little, they first of all run a wire up and they look at things and they shoot some dye in there.
When we prescribed the app to Don and he came back, he knew about all procedures of the heart.
Short videos explain conditions, treatments, and procedures. Doctors can save and send pictures via text or email to patients.
How it's changed the practice is it's ultimately changed how we discuss procedures and illnesses with our patients. We are now up to date with the times and not looking at forms and papers all along the wall.
I watched it probably 5 or 6 or 7 or 8 times, and so I completely understood exactly what was going to happen.
The app is now part of Dr. Grad's routine with patients. The best part, this prescription is free. As for Schleiser, he can't wait to celebrate his birthday and many more.
Every day I thank the good Lord that I was able to get this thing fixed.
And the app is free and available for both Apple and Android users. Just search for CardioVisual. Well, 6:33 now.
The Carolinas, Evan to Virginia.
Is earned.
Getting prepared for surgery can be a frightening experience, especially when complicated procedures are involved. That's why a group of Austin cardiologists have created something to make it easy for heart patients and caregivers to understand heart conditions and medical procedures. Joining us this morning to talk all about it, Dr. Robert Wozniak, to tell us about CardioVisual. Good morning and welcome to Weekend Daybreak.
Good morning. Thanks for having me.
Thank you for waking up with us. Yeah, so what is this app, and tell us what it does?
The app is exactly what you said. It helps us communicate more effectively with our patients with a trusted source of information. As you know, when you hear about something from your doctor, immediately you may go on the internet and say, well, let me try to find out more.
Yeah, WebMD.
and there's so many resources out there that have not been evaluated for their accuracy, and sometimes I spend my time undoing things, false information.
Right.
This is a way for me to concisely present information to the patients. I will use this during my interview or discussions with the patients, but also send them home almost with a prescription to say, please look at this video regarding your procedure or your illness, because as we know, patient care is really a team approach. Patient has their role, the doctor has their role. This greatly helps me help me get the information I need to those patients, particularly the more and more patients that I see that are culturally diverse society that we have. Effectively communicating with them is so important.
Well, and just remembering all the details too. You know, going to the doctor and they tell you to do everything, and it's just hard to remember. All right, so let's see how this works.
Well, it's really 3 taps, and any type of information that we want. It's a very well animated video here that we have from just generalized heart disease itself to a procedure that I'm going to say, you need this type of procedure.
So it has their condition on. This is your disease, this is what we're doing.
Exactly.
Okay.
So once they know about their disease more so, they're going to be more compliant with their medications. It's a very efficient way for me to let them fill in the information that maybe I didn't explain it well enough. And so they can have more informed decisions on the process and then ask me better questions that we can get at. I didn't understand more about this or what the results of the procedure was going to happen. The device itself has already been downloaded by thousands of patients. It's a free app. I mean, we want patients to use this
Sure.
because heart disease is so common, and it can affect the patients themselves that have heart disease. But if you have loved ones or even coworkers that you may be concerned about, the more educated we are with good, accurate information, the better we will be as patients and effective for helping our family or loved ones in preventing heart disease or treatment or successful treatment of the heart disease.
I wonder if you could give us an example of a common, maybe false, information that they looked up and they presented to you. And
very easy is that I'll talk to patients about having a pacemaker, and they think it's a car battery that's going in them or it's a major operation. After less than a 3-minute video, most of these videos are less than 3 minutes, they said, oh, is that all it is? It's the size of a disc, and I can have it done one day and leave the hospital the next day or even the same day. You can see the anxiety just fall from them and their family members, and it makes my job so much easier.
well, not to mention it saves you a lot of time, and you can spend that time on more important things.
Well, more important or filling in the places that need to be filled in.
Yeah.
And again, to talk to someone who has to translate, can you imagine what I have to do to try to translate? When you can see a video of something, it just makes it a much better appointment, which becomes much more often I see patients that I have a family member has to translate for them.
Well, you did say culturally diverse. Does it come in different languages?
That is being worked on.
Okay.
And so, but it's already in 70 countries around the world are using this. And St. David's Healthcare System has adopted this for their patient education as well. Our group is very focused on patient education and involving the patient as a team member to their medical care.
All right, doctor, thank you so much
You're
for
welcome.
showing us how
Thanks for
this
having
works.
me.
Absolutely. And of course, CardioVisual is available for free on Google Play and the iTunes Store. For more information about how it works, just visit the links section of kview.com.